Hey, today I want to talk about healthcare and health insurance. Hopefully, we don't get too deep into the politics because at the end of the day, the real end goal is health. Um, I've noticed that, so I'll tell you I don't know where to start with all this. You could start with a lot of different places, even without delving into the politics of it all. Um, but the truth is, for me, my philosophy of it is live a healthy life, focus on the health aspect, and then costs are going to necessarily have to come down anyways. So, like, what we do is, like, I have health insurance from my employer. And it's not bad health insurance. It doesn't cost a whole lot, but I really only have it for catastrophic events. And if there were a cheaper option outside of that, I've looked into HealthShare, Medishare, uh, and that looks good, but it would cost um, more, and it wouldn't be through my employer. And so, um, instead, we pay extra out of pocket for, I guess, a concierge service. It's like 200 a month or something. But the physician is always on hand 24 hours a day through my phone if I need to get a hold of them. A very small practice. They keep costs low. They're very transparent about how much everything's going to cost, that kind of thing. And really, we really like that. We really appreciate it. Something that I don't think that a lot of people do, that I've not seen a lot of people do, is compare prices. They'll compare, like, oh, is this doctor good? Was that doctor good? That kind of thing. But no one asks for pricing. It's hard to get pricing on a lot of prescriptions and medical procedures. Uh, Definitely before the Affordable Care Act got passed, and this is something that it seems the Affordable Care Act actually did that I really like. Um, it made uh, it made medical practices uh, be transparent about their costs, like how much it actually costs to perform certain procedures. You call them up, they're still not going to tell you, but there are other sites that collect and distribute that information, or can distribute that information to you. That way you can compare. And sometimes the difference is significant. Sometimes, prescriptions differ between $12 to $3. Okay, no big deal. But when the prescriptions are in the hunt, multiply that by 10 or 100, you're dealing with hundreds or thousands of dollars a month. That's a big freaking deal. Um, I don't think I'm that big of a drain on our health plan because I'm not using it except for catastrophic events. It's like our company had 20% of our emergency room visits were not emergency related. Apparently, people are going to we're going to the emergency room to get COVID tests, which is dumb on several levels. And that's not what it's for. The emergency room is not to get COVID tests. The emergency room is there so that you can not die. It's for an emergency. Come on. Um, I don't know. I haven't been in an emergency room since I needed stitches 25 years ago. So went down a hill is a little too steep. Um, but I heard this one example, and I guess I don't know how true this is. It's just an anecdote, but I believe it at least. There was one woman who took uh, a prescription to deal with flare ups. It turns out, and it was like $5,000 a month to pay for that. Of course, her plan paid for it, so she wasn't paying that much. But it turns out that she didn't have to take the prescription if she made some changes to her diet and to her lifestyle. I don't know how dramatic those changes are, but like it was possible to do. But she didn't want to make those changes, so instead she was going to drain the company plan by 5,000 a month, by 60K a year. Um, that's her choice, and that's the company's choice to keep employing her, of course. I'm just saying, from my own personal individual point of view, I don't want to be that kind of a drain on the company. Um, so I would pick the cheaper, the less the less costly option of, well, I'm just going to eat healthier, and that's something I've preached on this channel a little bit over the past couple of years, and it's something that I try to live in my daily life as much as I can. I'm under 180 pounds now, which is 25 lower than I was like 6 or 7 years ago. So I wasn't like terribly fat, but I saw, over 200 pounds. I'm like, okay, I got to take this seriously now. So I started exercising more and I started eating healthier. And over time, I'm eating much healthier. I'm looking at ingredient lists. I'm figuring out, oh, I have hemochromatosis, which means I can't eat raw meat. I can't eat uncooked meat, undercooked meat, that kind of thing. I'm learning more about my body and I'm living a healthier life. Um, I'm taking good supplements that they're optional, but whatever. Um, and I'm just living an ultimately better life on top of not having to pay a whole lot for stuff. Um, that's really my message at the end of all this is, we shop for auto insurance, life insurance, homeowners insurance, if we have a home, life insurance, if we look into that. Um, it's not really an option with health insurance. Um, and again, I'm not going to get too deep into the politics about that. But one thing that we can do while the Leviathan slowly figures itself out is we can make some choices on our own to live a healthier life. Um, I encourage you to look for the ways that you can, and it might just be walking a mile a day. It might be lifting weights for 5 minutes every day. It might be cutting something out of your diet that you know is bad for you. It might be having one cheat day a week instead of four. It might mean going and seeing a doctor more than once every 5 years, every year instead of every 5 years. You know what I mean? Um, Maybe it's getting a second opinion. Um, I had a dentist who said, "Oh, you got a mouthful of cavities." Well, 7 years later, my teeth are still fine. Because I went to a second dentist and he was like, "No, we only got one that we got to keep an eye on." So, um, turns out doctors are human, and humans make mistakes. The human variable doesn't. The human variable does change. It's not taken away. So do your due diligence, because you may not want to see yourself as a consumer of healthcare or a purchaser of health insurance, but that's what we are. So that's my encouragement for today. Hope you're having a good one. Weather is fantastic out here. If you can get outside, have a good one.